Hello, everybody. I'm Steve Edelman, founder and director of Taking Control of Your Diabetes. My good friend and colleague, Jeremy Pettus, also director of the Type 1 track. Michael DiNatale, our guest from Boston. And this is part of a series of Facebook Live that we've been doing. Many of them on COVID. They're on our website. So please visit the website. Also, we have blogs for people with Type 1, Type 2, and significant others. And we go through the blog every day. Probably more than that, and answer everybody's questions. So basically, we want to jump right into it. Before we started, we were talking to Michael. He lives in Boston, about the Patriots and sports. But now we're going to talk about his journey developing COVID-19. And very happy to be here live to tell us about it. So Jeremy, you want to say a few words before we get in and asking Michael about his story?
Yeah. So first of all, I'm Jeremy Pettus. I'm an endocrinologist at UC San Diego with Steve Edelman. I have type 1 myself since I was 15. And for you TCOYD fans out there, we've been doing a lot of this virtual content now. Kind of the data of COVID-19, infectious rates, complications, all these kinds of things that we can glean from publications. But we thought it would be great to actually speak to somebody living with diabetes who contracted COVID-19, their story through, what it was like, kind of getting through the disease, what happened to their blood sugars, all these kinds of things. Because, for better or worse, Steve and I were talking, and we see a good number of patients. We're kind of connected to the community, but neither Steve nor I have a patient or known somebody personally that has gotten COVID-19 that also has diabetes. We've had extended friends or whatever that have actually gotten COVID, but not living with diabetes. So we want to learn from Michael just as much as you guys do. Obviously, keeping in mind that Michael doesn't represent every single person with diabetes, but we have to start somewhere in hearing somebody's story, somebody type 1 and COVID. So Steve, do you want to?
Yeah.
Or Michael, Steve, you take it away.
Well, you know what? I'll just start with the first question. Jeremy and I are both going to ask questions. I was also going to add to what you just said, Jeremy. Not all people with diabetes are created equal. We have type 1, we have type 2, we have some with good control, some with not so good control, underlying conditions. So we can talk about that as we go through. Okay, Michael, thank you once again for sharing your story, and tell us about yourself, about a little bit about yourself personally, about your diabetes story and what you're on and things like that.
Sure, thanks. And I really appreciate you having me. I hope that we can help some people out there that do have diabetes. So I'm actually honored to be able to do this for you guys. I'm Mike DiNatale. I live in Boston. I'm 57 years old. I've had diabetes since I was 27, so I got it kind of late, type 1. I'm currently on Humalog pen. I take 1 unit for every 10 grams of carbs, approximately. My nighttime insulin is Toujeo. I have a CGM, which is a Libre, which I love. I just love having the CGM. It makes life so much easier for testing. I mean, that's what it's all about, really, to control our blood sugars is knowing where your sugar level is. So that makes it, I'm just so happy to have that. I'm in very good health, probably the best health of my life. About 5 years ago, my girlfriend got me into yoga, and it really changed my life, both physically and spiritually. So that's something that I'm very grateful to her for. Right now I maintain an A1C of about 6.8.
Wow.
Yeah.
That's impressive. Next time we do a show like this, I'd like to see you in your yoga leotards, please. You know what?
Yeah.
Yoga.
A little power yoga never hurts anybody.
Yoga's awesome, especially the one where you go into the steam room, relax, have a beer in there. That's perfect.
I'm not familiar with that.
Yoga.
Oh no, it's
That's just drinking.
Bikram yoga, right? You pay money to sweat. No, I seriously, it is great. Okay, well.
So around mid-March, I lived with my girlfriend, and she started developing some minor symptoms. She had a low-grade fever, some aches and pains, and she never gets sick. She's in the wellness field. She eats a plant-based diet, very healthy person, and very rarely do I see her get sick. And she was kind of, a little funky for a day or two.
Didn't she
And
go to a conference that you?
Yeah. So the reason she was nervous is that she had gone to an event at the Marriott Long Wharf, which ended up being the same facility where they had the Biogen conference that the big outbreak in Boston occurred. So this was she went about a week later. So she was a little nervous. She called, tried to get tested, and they wouldn't test her.
What was
she didn't have
her symptoms?
They wanted symptoms,
She didn't have any symptoms?
She did. She had a low-grade fever. So, but they wanted something over 100.5, and her fever was like 99.5. So they had they had a protocol on who could get tested, who couldn't. So about a week later, March 23rd, I started to feel a little icky, and a little bit of a fatigue, a cough. And that's when we both noticed that we both had lost our sense of smell. We had seen an event, something on the news that this could be a symptom, and we decided to check, and we found out that we both could not smell anything. I mean, she had some essential oils that if you held them up to your nose, it would basically, just blow your brains out pretty much. And we couldn't even smell them. So on March 25th, I got tested, and I actually had to lie because the first time I called, I told them my fever was 90, what it was 99.8. And they said it had to be 100.5. So I called back the next day. I lied about my fever, and I got tested, and I tested positive.
So how did that work? Did you go into a clinic or to the emergency room, or?
No, it was a drive-through held by one of the hospitals in the area, South Shore Hospital.
Michael, when your girlfriend started to develop a fever, were you sleeping in the same bed as her? Would you have changed? Would you have done anything different, knowing now that she had COVID?
Yes, we should have self-isolated at that point. And it's so weird because, that was early on, right? That was just, March 25th, 23rd. We were still going out, like the week before, we were still going out to dinner, and, we didn't think it was that serious. And I still personally don't think it's as serious as enough to shut down the entire country. But that's my own opinion.
So did she ever get tested?
She did after I tested positive. The city that we live in, they mandated that anyone in the household would get tested. So she got tested, and she tested negative. But at this point, it had been 2 weeks after she had symptoms. So
when you got swabbed and they sent you home, and then what, did they call you the next day?
Yeah, it was 2 days later.
2 days. Yeah. And then what was going on with your symptoms and everything at that point?
Yeah. So at that point, things were getting a little rough. It was really like a bad flu. A lot of fatigue, fever, cough, congestion. But the worst part of it was the headaches. The headache was the worst I've ever experienced. I've never had migraines before, so I don't have nothing to compare it to. But I have to imagine that that's what a migraine feels like. And that went on for a while. That and the fatigue is what held on for like a week.
And sorry, Steve, but what was going through your head at this point? Did the fact that you had diabetes, was that a concern of yours? Was that something that you were worried would make you at higher risk of not coming out the other side, or how were you thinking about it?
I think it was in the back of my head. My sister is a holistic veterinarian, Dr. Constance DiNatale. She's down in Orlando, and she was really concerned because she's in the holistic medicine. She works a lot with China and Asia, and she was really concerned. As a matter of fact, she sent me some Chinese herbs that 86% of the Wuhan patients were receiving for treatment. And when she started getting involved and sending me those things, I was getting a little nervous. There was one night that I was having some trouble breathing. Not so much I could breathe, but taking deep breaths and coughing. And I said, geez, I may end up in the hospital tonight. And that's the last place I wanted to go. So I think with my will, the fact that I'm in pretty decent shape, and the herbs that my sister sent me, I think those all together kept me somewhat healthy and out of the hospital.
You know, Michael, could you get a little bit more into your pulmonary symptoms? So I want to know, what was the cough like? Was it a dry cough? Were you coughing up big old loogies, or phrase I used when I was in elementary school? You know, you said congestion. Did you have to like blow your nose? And did you take
Yes.
any over-the-counter medications?
Yeah, so I was just taking Tylenol and some little pill that the doctor prescribed to me. It looks like a vitamin E pill. It's small. It's supposed to be for the congestion. Maybe you guys know what those called.
Tessalon Pearls, was that what it's called?
That's what it was.
It's like a cough suppressant. It doesn't help so much with congestion.
Yeah, but it wasn't hucking up any big lungies. That's what we call them out there. So it was a dry cough. And then the congestion, if I took a deep breath, it was like, I've had pneumonia before. So, if you take a deep breath in, that I like to do, my yoga breathing, and I would just start coughing. So that was kind of tough.
And what about, did you notice, like, some people say that when they sleep on their stomach, it felt a little bit better. Or did you notice anything like that? Ways to make it easier for you to breathe?
So one of my sleep problems is I have sleep apnea. So I have a CPAP machine.
Okay. Interesting.
And I like sleeping on my side, but I can't with that thing. I have to sleep on my back. And so, I stayed on my back most of the time. And,
Did okay.
I had 2 really bad days.
Yeah.
And, but I got the flu last year for the first time in 10 years. And I tested positive for both strains, which was weird. Because I always get my flu shot. I think that's really important for us diabetics. Get your flu shot. But last year, for whatever reason, it didn't work. And I was laid up for 3 or 4 days last year with the flu. So I had something recent to compare it to, but it was those other symptoms, and then the news, hearing about all these people, it's getting me a little freaked out.
Yeah. Hey, Michael, a lot of people think sleep apnea is only in people with type 2 diabetes, for people who are really heavy. And there are people that would probably say that could be, an underlying condition that, if you have issues with aerating your lungs, and if you got COVID, what happened to your diabetes control?
So yeah, and you guys probably know, when you get sick, your insulin, you just got to take more insulin. I doubled my insulin intake. So I went from 1 to 10 to 1 to 5 for my Humalog.
And you still have an appetite? Were you still eating?
Yeah, that was the other thing. I did. I still maintain my appetite. I ate very healthy. I didn't eat any junk. I stayed away from dairy. Ate a lot of vegetables, spinach.
What about Boston baked beans?
Just the cream pie.
So
yeah,
what about?
When you're
Sorry,
stuck
go
at
ahead.
home, you don't want to eat a lot of beans.
Yeah,
Although,
you're right.
that was I now that I think back, that's one of the regrets, because I could have gone crazy because you couldn't smell anything anyways, right? So
how did your blood sugars compare COVID to when you had the flu? Did it seem any different in terms of because I think everybody with diabetes is used to getting sick and having to deal with higher blood sugars, a little bit more insulin, that kind of routine. But would anything stand out with COVID in terms of your diabetes?
No, I would compare it to the flu. Elevated. If I was keeping it under 200, I was happy.
Yeah.
But you'd see, and then all of a sudden you'd see a 300 pop up, and you're taking 15, 20 units of insulin just trying to come down. I remember just taking so much Humalog. It was crazy.
Yeah.
Yeah. Yeah. What about your daughter? You told me your daughter has type 1. And did she come over and visit you, or she said, "No way, Dad, I'll FaceTime with you"?
Yeah, no, she stayed put at her house, and yes, what a sweetheart she is. She's 23, Paige, love her to death, and I actually have 4 daughters. But Paige, she was my firstborn, our firstborn, I should say, and the first thing I said, I went to the doctor and I said, "What are the chances of her getting diabetes?" Because I was really nervous about that. And he told me, "Michael, the chances of her getting it is the same as anyone else's." But as we came to find out, both my ex-wife and myself were both carriers for the gene. So she had like a 1 in 4 chance of getting it. So.
And your other 3 daughters, they're with you and your ex-wife, or your third or fourth wife, was that?
Well, we won't go there.
So
no,
let me ask you something else. So you said that, you thought about going to the hospital, but it was the last place you wanted to be. Was that because you were just worried that you had COVID, you didn't want to expose people, or you just didn't want to have any consideration of them putting you on a ventilator, or what was your thought process there?
Yeah, Jeremy, the thing I thought about the most is if I go into the hospital, I might not come out. So you start to having those thoughts that, I just didn't want to, I wanted to live. And I didn't want to take that turn.
Yeah. So then when did things kind of turn around for you? You said it was 2 bad days, and then after that, you slowly started to feel better, or how long?
About a week. And then on April 1st, I had no more symptoms. And then on April 3rd, I got tested, and I tested negative.
So it was about a week in total that you felt bad.
Yes.
Yeah. With 2 days that really stuck out as kind of hell.
That's right.
Yeah.
Did you get your, oh, go ahead, please.
No, the only thing I was going to say is, the only side effect is I still don't have my smell back.
Oh, really?
It's come back about maybe 50%, but it's been over 2 months now. My girlfriend got her smell back within about 2 weeks. So I think maybe the longer you have the symptoms, the initial symptoms, maybe the smell goes longer. I don't know. That's, one of the questions I have.
Yeah. Jeremy, have you heard of any explanation why people lose their sense of smell with COVID?
I don't know, to be honest.
I don't know.
I mean, COVID is an amazing virus in terms of the systems it affects, kind of everything as more we learn about it. So clearly there's a neurological component to it that's affecting your sense of smell. But I don't know anything on who that affects more likely and how often it comes back and things like that. But it seems like, Michael, that's an opportunity for more essential oils for you. Just lather them up, I guess, and go to town.
Michael, now that you have it, have you had the antibody test, and how do you feel about walking around town going, woohoo, get a t-shirt that says I had COVID, and do the moonwalk across the Comm Ave or something like that?
So I was dying to go to Florida to visit my parents. I was scheduled to go in March, and like a trip got canceled. So I did go for Mother's Day to go see my mom. Hi, Mom. Had a great visit, but I was very careful because last thing I wanted to do was pick up the COVID, on the plane or in the airport, and then give it to my mother, who's 80 years old. So, that's something that I just don't understand. You know, can I get it again, or can I be a carrier and give it to some? Like you not get infected, but could I actually carry it and give it to somebody? So I practiced all the social distancing and hand sanitizer, wash my hands. I was very careful about that.
And there's been so much about these antibody tests, and particularly, a ton of these flooded the market, and the accuracy of them has been in question for a long time. So I'm curious, did you ever get that test, or you think you will?
So, after I recovered, I started thinking about I wanted to help, and that's how I found you guys. I saw a local news broadcast about your programs and how you're studying COVID and type 1 diabetes. So I reached out. That's how we connected. And then I reached out to the American Red Cross because I wanted to donate plasma, which I didn't know if I could even do. I used to be a blood donor before I had diabetes. And for some reason, I didn't think I could give blood, but I guess you can. So this past Sunday, I went into the Red Cross chapter here in Boston in the theater district. Spent a couple hours there, gave them my plasma. And I haven't found out, they were doing, but I haven't found out
if you carry
if I actually have the antibody or not.
That'll be interesting.
Yeah.
And Michael, how has this changed your opinion on the virus in general? I mean, it's kind of a hard question because you got it so early that maybe you hadn't even really formulated how you thought about it. But having gone through it, I mean, what is kind of your advice to friends and families and, wearing masks and social distancing? Have you become like a real champion for that? Or you kind of mentioned that, I don't know, what's your thoughts on that?
Well, I think that the majority of people that get it, and I'll give you a perfect example. Two of my girlfriends, her son and daughter, also lost their sense of smell, but it was the only symptom that they had. So we feel that they also had it. They're going to get tested for antibodies. But I think there's a lot of people like that, younger people that have had it, that don't even know it. And so my thought is, I think it's important, right, that we take care of ourselves and be aware of germs, not only for this, but it's always. I mean, you should be aware of, just opening a door, the carts in the supermarket, things that people touch a lot. You can pick up diseases. And it's probably how we got how I got the flu last year. But we've never shut down the economy for the flu. But I think some of the things that the government is doing and a lot of the safeguards that we're doing now for the COVID should be embraced as just a natural thing to do, because there's hundreds of thousands of people are dying from the flu every year, but we've never taken any of these measures. So my thought is, what I think is going on right now is a little bit overboard, and I'm glad things are starting to open up again. But I think we just need to be more careful as a society about washing our hands, and be aware of passing germs around.
Yeah, I agree with you. One thing I'm thinking about as you live through it, anybody that watches news, they focus in on New York City, which of course was hit the hardest. And, not having COVID, being in San Diego where we have not been hit hard at all, and they had 800 folks pass away in one day for multiple days in a row. We've only had a total of 260 the whole 4 months. That must have been really scary. What were your thoughts when you were watching the national news and the crazy lack of, I would say, the lack of PPEs and ventilators and all the people passing away, putting it in refrigerator trucks. I mean, I having it yourself must have thought, geez, I am lucky, one lucky SOB, you know.
I really do feel lucky, Steve. And, you know, I guess I give a lot of it to my health and taking good care of myself.
Yeah.
And having people that care, you know, having people that care and support me.
So, you know, a couple of questions coming in kind of around your blood sugars and things like that with when you had the infection. So there's some data now coming out showing that blood sugar control during the infection is helpful, meaning that the more tightly you're controlled while you're infected can maybe, you know, lead to better outcomes. That data wasn't available when you had it, but do you remember thinking when you were infected, like, gosh, I need to do a really good job of controlling my blood sugars to improve my immune system or anything like that? Or was it more just like, I'm just going to take the insulin I need to just try to get through this?
I just wanted to keep it down. I love keeping it down below 150 anyway. And, you know, I would start, you know, with the CGM, it's just so easy to test and watch and see the trends. And, you know, as soon as I would see it trending up, I would start taking Humalog. And sometimes I'd be taking Humalog within 2 or 3 hours, taking more, just trying to keep it down. And I don't think I may have gone low once in that amount of time. So, you know, taking 30 to 40 units of Humalog a day and only going low once, I think, you know, it just shows you how tough it is to control it, but you got to do it. I mean, because when you're up high, you feel like crap anyways, and you don't want to feel worse.
Yeah. You know, my personal doctor opinion is that people with good control, you know, your A1C was excellent. I think that gave you a better chance of not going to the hospital, not getting really sick. And we know that people with really high blood sugars, they're more prone to infection. And unfortunately, you know, from research that Jeremy and I have done, looking at A1Cs in people in the US, you know, only about a quarter of all people with type 1 have an A1C less than 7, because type 1's tough. So,
yeah, it is.
And everyone's got their own way of dealing with it. You're doing an awesome job. You know, the other thing that people talk about is the glucose variability. Like, are you familiar with that word, phrase, time and range? The percent of blood sugars between 70 and 180. You know, and
I'm not the doctor here, Steve. That's you.
well, you can look at your download, buddy. No, it's obviously A1C is just an average, but you know, a lot of people are talking about, you know, wide fluctuations, and it sounds like you have not had that. Your Libre download probably gives you that, but I couldn't imagine you being any better off than you are now.
Well, yeah, you know, and like I was saying, we have this big publication that came out of the United Kingdom now that kind of got everyone freaked out, showing that people with type 1 diabetes have like a 3 or 4-fold risk of dying from COVID once they get infected. But
Really?
the other, you know, risk factors are things that we kind of already knew, that obviously older people are at higher risk. And this, somewhat surprisingly, obesity is something that came out. So I think being in good health, physically in shape, you know, that's helpful. And then once somebody has diabetes, it's not either, you know, you just have it or you don't. Good control still matters a lot. So I think, you know, a central message for people is staying healthy in general, controlling your blood sugars as much as you can, you know, anyways. If you do get an infection, you probably will need, you know, more insulin. There was a question about long-term effects of higher insulin doses, and I don't think anybody should be worried about that at all. You know, you have to take the insulin that you need to take to keep your blood sugars under control, because that, you know, ultimately leads to less complications. Now, other people were asking about, did you kind of go on your own with this, or were you in contact with a physician, endocrinologist? Did you do any of the virtual health stuff?
No, I was pretty much on my own, except for my sister, the veterinarian. I do have this little itch now, like from her. No, but yeah, she was great. She would call me 2 or 3 times a day, make sure I was taking the herbs and you know, just checking on my health. So yeah, she was really my proponent.
So do you,
Dr. Constance, love her. Hi, Connie.
are you, how confident are you that these herbs, California, we're legalized to smoke it, but not to smoke it. How confident are you that these herbs helped you?
Well, I didn't smoke any of them, Steve. So, but I think I think it helped me a lot. I do.
Okay.
Now,
Yeah.
did you, since you didn't see a doctor or call anybody, did you feel, again, because this was so early, that you couldn't, that offices were closed, et cetera? Or is it just you felt like, I got this, I don't need help?
I mean, look, my doctor's office did reach out after I tested positive, and they gave me, some instructions what to watch out for. Take the Tylenol. They prescribed that other decongestant pill or anti-cough.
Yeah.
But that was about it. I mean, really, if you're not feeling good, go to the hospital. That was it. And that's the last place I wanted to go.
Well, it sounds like you have an HMO versus a PPO, so that's minimum care. No, I'm kidding. I'm glad that they reached out to you, and I think everyone here, depending on your level of freaking out, most of us would like to stay at home. But the thing that's scary to me is that some people, their only symptom may be lack of sense of smell, and the other person may be the same age, the same sex, the same medical conditions. They get deathly ill, need to be put on a ventilator, and I think that's just an unknown question we have.
Yeah, I definitely feel very lucky, fortunate, and I'm glad I'm here talking to you guys.
Yeah, hopefully we can meet face to face one of these days too. Jeremy, any other questions coming in?
Yeah, two. Of course, now we've got a flood of questions on what these herbs are. But before that, what's that?
You can start Michael. You can start import-export business. Get your sister going.
But first, and you can tell us about the herbs. Anything you tried when you were sick that you wouldn't recommend? Anything that you did that didn't work?
No, I don't think so.
Okay. All right. Well, then tell us about the herbs, I guess.
Yeah, so I can't really pronounce them. Ganmoling. It's GANMAOLING. That was one of them. And the other one is Zai Cho Hu Pian. That's XIAOCHAIHUPIAN.
Sure. Sure.
You got it?
Ganmo Ying and Zaiman Chu.
You know those?
Yeah.
Never heard of them. But, I think that the comment that we have to make is that everybody's looking for a silver bullet, in terms of what can I take to strengthen my immune system. And there's all kinds of things out there that really haven't been tested. So, there's nothing that we can officially recommend. If these helped you, great. But, we're not going to recommend everyone go out and Google these, even if they could Google what you just said. But, people are asking vitamin C, zinc, all these types of things. Really, we don't have anything that we know that can, help boost your immune system specifically to COVID. Things that have been proven, again, is just, keeping control of your blood sugars, making sure you get, your 8 hours of sleep, exercise, eating healthy, these things that are harder to do, but they do matter. So I think those kind of tenets of health are important.
And like I said, I don't feel as though the herbs saved me. I'm sure they helped. And one of the things she sent me was, specifically for headaches, which, the Tylenol did a fine job, these acetaminophen did a fine job for that. But I think it's, everything put together. And, I think being healthy is the number one. Controlling the sugar levels, maintaining the A1C, and being in good health, working out, however that is. I mean, you don't have to be lifting weights every day to be in good health. And yoga's a great way to do it. I recommend it to everybody.
Yeah, the other area that's in the people talk about is hydroxychloroquine and the antiviral remdesivir. And both of those are not silver bullets, but they have some studies to show that it may help. And I know it's on the formulary at many hospitals. So I think they use them as a kind of a last ditch effort when people are looking like they're getting very ill. So yeah, we'll look forward to getting some more therapies so that people can prevent them from even getting to the hospital.
Yeah, I think, Steve, maybe we can start kind of wrapping it up, but you wanted to ask Michael if he had advice, and you kind of have said this, Michael, but let's say your daughter came down with COVID or anybody else that you cared about, how would you help them get through it? Or just kind of your overtake on it, that kind of parting thoughts that you want to leave people about it.
Yeah, like, what kind of advice? I mean, one other quick question is which I think I asked, but I'm not sure, looking back now, is there anything different you would have done? I know we talked about your girlfriend getting sick, but knowing what you know now and getting it and surviving, would you have done anything different?
Yeah, I think we would have done the self-isolation. That's what we didn't do. So I think that's really important.
Okay.
And but that's, I think, really the only thing that I would have changed. And as far as recommendations, if you get it, I think, obviously if you're older and you have other health conditions, I think, if you feel like you're having trouble breathing, get to the emergency room. I mean, that's where you need to go. But I think if you're healthy, follow your doctor's, prescriptions and orders, stay in bed, drink fluids, and keep your diabetes, keep your sugar levels, test. If you don't have a CGM, get one, because they're awesome. I love it.
I'm just thinking one thing that would be different if your story was told today is that your girlfriend probably would have been tested. I think the testing is definitely getting easier, and so you probably would have had that information a little bit sooner. And
that would have helped. That would have helped, because I think, thinking back, we probably thought, well, she probably doesn't have it, right? Because it wasn't compared to what people were going through. All the people going to the hospital, she was sick for a day or two, and then she was fine. So, I think we were thinking that she probably didn't have it, and then the fact that you try to get tested, you can't get tested. It's like, well, whatever, we're not going to bother. But yeah, that's the testing part of it, Steve and Jeremy. That's key, right?
Yeah.
The other thing is, you mentioned that she noticed she lost her sense of smell because she deals with oils and perfumes, I guess, and things like that. But, believe it or not, there's a whole body of literature that people lose their sense of smell. They may not notice it for several months.
Right.
It's just,
yeah.
So a lot of people don't even realize, but once again, it's just amazing how she got sick for a couple of days, and then you got sick, but you certainly didn't need to go to the hospital.
No.
So,
no.
Okay, as we're closing, I have to ask you, are you going to be rooting for Tom Brady and the Tampa Bay Buccaneers? Are you pissed off at him?
No, come on. No, he's the GOAT. So yeah, I'm pulling for Tampa. I want him to go all the way to the Super Bowl. I want him to win. Because we've got six rings up here. Tampa only has one, right?
I don't even, Tampa Bay, who's that? Isn't that a place where you go fishing or something? I don't know. I want to say thank you very much for taking the time. It's been a pleasure to get to know you. We spoke the first time a few weeks ago and more now, and I'll look forward to meeting you in person one of these days and have you come to one of our Taking Control of Your Diabetes conferences. I'll let you know about our next virtual conference. And of course, our big weekend conference in San Diego for people with type 1 diabetes, going to be virtual this year, but next year, it's going to be face-to-face. And that's an awesome place to be for 3 days. Jeremy?
Yeah, but since I've already had it, I can travel. So I'm going to come out to San Diego because it's one of my favorite cities in the world.
You have an open invitation. Come on out live for the virtual. I love it. We'll
all right.
Together on the computer.
I'd love that. Count me in.
Yeah,
Okay.
I just want to say thanks, Michael. This has been great. I think this was a curiosity of Steve and mine and of everybody, really. So you learn a lot, just talking one-on-one with somebody. So thanks for doing that. And I hope that the community, feels like I do, that we're just really appreciative of you taking the time.
Yeah. All right. Well,
Thank
thanks
you very
again.
much.
And tell any of your relatives, your mom, you can watch it 2 to 3 times. We're going to have it on our website.
Okay. So I just want to say hi to my girls. Hi, girls. I love you.
All right.
All right.
All right.
Thanks, everybody.
All right. Bye-bye. Thank you.